Vacciboxes is a company that manufactures solar solutions, and our flagship product is Vaccibox, which is a solar-powered vaccine refrigerator that can be used to transport vaccines, medications, and even blood transfusion to rural and hard-to-reach areas using methods of transport that are readily available, whether it's a motorbike, a bicycle, or even a vehicle. We are flagging off a project that we are doing in Turkana County, funded by GSMA. We will be rolling out 20 Vaccibox units to facilities in Turkana County, as well as supporting an additional 20 facilities with remote monitoring hardware to provide monitoring capability to their content equipment. We are here to address a need that Turkana, like many other counties in Kenya, are experiencing, which is poor access to electricity as well as infrastructural gaps, and that has had an effect on the delivery of healthcare, and we are here to try and solve that problem.
I really want to commend what Dropboxes are doing because it's a local invention, and we just want to plug in because it's an invention that is on time. It is an invention that is viable for us as a Ministry of Health, and my presence here today is to see the kind of working relationship, the kind of co-creation we can work together with Dropboxes, because as a ministry we are really open in terms of supporting the co-creativity programs that will support our programs. I know they have come up with a Vaccibox, which is going to help us a lot. Out of the 300 facilities, the last 2 years, there are only 64 facilities which used to vaccinate. And our major aim right now is to ensure that all our facilities are able to do vaccination services. So through their help and also through the help of other partners, it is going to help us to give some vaccine boxes to facilities which are far-reached areas, and they will now be able to vaccinate. Out of the 300 facilities, we want all of them to vaccinate, and it's very expensive to have a fridge. So by them coming on board, it's going to help us enable most of our most of our facilities to vaccinate. So it's able to help us, especially next. We're having some outbreaks in terms of measles, which is as a result of the broken cold chain, and have seen the Vaccibox is a good one in terms of even in storage, even in terms of the capacity. They have the solar. Turkana is full of sun, and we are able to harvest that. And we don't need even electricity, or we will not even need a lot of generator coming on board. As long as you have the power, then we can be able to store our vaccines well, and it's going to help us in terms of safety of our vaccines, effectiveness, and also avoiding in terms of waste. So it's a welcome idea to us because it's going to increase our vaccination coverage in most of our facilities. I know these vaccine boxes are able to keep the vaccines for 36 hours without even maybe plugging into the electricity or maybe charging. And this is going to help us a lot. We are having a lot of outreaches across the county because Turkana is a nomadic population, and most of them live to remote areas where there are no roads, and we do tend to take vaccination services to them. I know these boxes are able to help us even in terms of carrying those vaccines to those areas because potency of vaccines is important to us, so that now those children are able to receive the correct vaccine. So it's able really to help us support our outreaches because now we'll have the right vaccines with the right potency, and also the confidence. Sometimes it's good for you to assure your client of the confidence that what we are giving is the right dose, and then it's also viable to most of our clients.
The thing about Vaccibox and how we wanted to solve this problem in a very innovative way was for it to have a dual purpose. We wanted it to serve facilities, to be installing facilities for stationary placement. People can come there and receive their care. But also the same device can be used to go out into the community, do an outreach, do door-to-door vaccination and things like that. And that is really cost saving as well as preservative of the vaccines and the other items that have been stored there. So it has many use cases and provides a lot of versatility in terms of how healthcare workers are able